Happy Friday, welcome to the show. Today we got acupuncture, fake nursing degrees, and Heidi Montag plastic surgery revelations. Oh my, it's gonna be a great show on Nip Talk and it's starting right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle. With your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer, Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you so much for tuning in. I'm your host, plastic surgeon Dr. Bruce Hermann. With me as always, Sarah Bennett,
Hi.
co-host. In the box, we got the man, the legend, Travis. What's up, dude? How you doing?
What's happening? What's happening? I have a guest as well.
Oh, yeah, we do have a guest.
Yeah, we have a guest. I'm gonna let her slide in. Go ahead.
Hi.
That's my daughter, yep. So I don't know if you guys keep up with the weather with the Dallas Metroplex, but
Right.
it's been a snowstorm, so my daughter's out of school.
Yeah, speaking of which, driving here, like
Was it bad driving for you?
It was 50 degrees outside and it was just wet, but people
Yeah.
were acting like it was snow.
Yeah, I think what was
They're
happening.
slamming on their brakes
Yeah.
as soon as they go over bridges. I'm like, what?
Yes, that's what I was about to say. The same thing.
on?
Like traffic was going pretty fine, and then you get to a bridge and be like, "Arr!" I was like, is there a wreck? And
No.
no, it's not.
I think it's just like, maybe it's like the glare of the
Yeah,
water.
people would see it, they would freak out. Yeah.
Yeah.
But I don't know. Like I'm actually like happy that people are at least being cautious. I mean, I don't know if for anybody who's watching this not from Dallas, people here drive crazy fast, which is fine when the weather's nice, but like in the ice and snow, people still drive crazy fast.
Yeah.
And then people are just
Well,
like,
I just turned on my 4-wheel drive. I was like,
Yeah.
it's gonna be wet outside, so
Oh, yeah, big time.
I'm just gonna turn it on.
Did you?
just in
Okay,
case.
so everybody who's watching is not from Dallas. So there was a huge ice storm on Monday, Tuesday, and
Yeah.
Wednesday, right? So
Right.
essentially, the Metroplex has been shut down since Monday afternoon. I did surgeries Monday morning, and then like it started getting bad. I went home, and then luckily I only had like clinics on Tuesday, Wednesday, and Thursday. So those were just canceled more or less. I did go out Tuesday just briefly, and I went out Thursday. But did you guys get out on Tuesday, Wednesday, or Thursday?
So this entire week, my daughter didn't have school,
Oh, okay.
and then
So you probably were at home, right?
yeah,
Okay,
and then
nice.
everything was cool at my house until last night. The electricity went out. It went out for
Oh,
over
no.
24 hours. So it went out at 5 a.m.
Oh, no.
And then it didn't come back on. Or
Did your
not
house get
over
really
24
cold?
Hours, but no, it's because my house is fairly new, so it has spray foam insulation, and that's
Okay,
like the
so
best
it holds-
one you can get.
Yeah, it holds insulation pretty well.
Yeah, it's pretty good.
Yeah.
So it got to like 54, and I keep I keep my house at 64.
Okay, so for you it's like just maybe slightly
Because
down.
I am super hot natured.
Are you really? Yeah.
Yes.
What about you, Travis? Did you have to get out in all this craziness or no?
So I did. I came up here one day.
Oh man, I hope you got paid overtime for that.
No, we did not. Maybe
What?
like
where's
hazard.
the boss? I mean, we gotta get hazard pay.
Right,
for
we
this.
need some
Do you
hazard pay
at
or
least
something
have
like
four-wheel
that.
drive?
You said what?
Do you at least have four-wheel drive?
No, I have a Grand Cherokee, but it doesn't have 4-wheel drive.
Uh-oh.
Doesn't
Yeah.
have 4-wheel drive. But it wasn't that slick. Like this was yesterday too. So
Yeah,
yesterday
wasn't terrible.
Yesterday was fine.
Yeah, yesterday it was a little bit more like melted. So
Yeah.
But other than that, I kind of just stayed in.
Wednesday, I swear the roads were just like pure ice. Like it
Oh,
wasn't
yeah.
snow; it was just pure ice. Like
Yeah.
it was.
Yeah.
It was bad.
Yeah,
There was
Avery
so
and I
many.
were
There were
skating
even.
on our driveway.
Oh,
It
were
was
they?
like straight ice.
It was very frozen.
Even driving here, I saw probably a dozen cars still in the ditch from like the past 2 days.
Oh, really?
Oh, yeah.
We were doing radio from like the closet, from like our houses.
Oh, were you?
Yeah, we were like patching into the station. So
that's
it was
pretty nice.
quite an adventure. It was quite
Yeah.
an adventure.
Well, and of course, school was out, so like everyone's,
Mm-hmm.
had kids, had all the kids were just cooped up, and my daughter was begging me to get out. She's like, "Can I come to the studio with you?" I'm like, "Yeah, sure." So anyway, all right. Well, yeah. So I guess with the week of ice apocalypse, I mean, there's not much, exciting to talk about.
Yeah, people call it like Dalaska. That's what it was called.
Alaska. What does that mean?
Dalaska, like Dallas, Alaska.
Oh,
It's like a
Dallas,
affectionate
Alaska.
nickname when it get cold.
It's like they
Dalaska.
come. Yeah, they come up with a different like.
it was like legit this time though. I mean, sometimes they close like schools or work.
Snowmageddon.
Snowmageddon. Yeah. Sometimes
was,
they
like,
close
last
stuff
one.
because it's like, a little, but this was like legit, like just ice, like huge amounts of ice.
Yeah, because of like the thunder sleet or whatever they were
Oh,
calling
man.
it. It was just straight up like frozen raindrops.
You know, I've lived in the north. I lived in
Little pellets.
I lived in Kentucky for a while, which is not really the north. That's like the Midwest. But I lived in Michigan, and like when I was in Michigan, like there was basically snow on the ground. I mean, almost the entire year, except for like July and August. But I'll tell you, it wasn't ice like it is here. Like something about this area, like we don't get snow, we just get pure ice, and then people drive like 200 miles per hour, and it's just chaos.
Yeah, it was somebody else was saying too that I think like people would have like ice on their cars and then they would get on the freeway to
like-
drive. Yeah, and the ice would just come off
Yeah, that happened
and
to me.
hit people's cars. Like,
Yeah.
This is crazy.
Same.
I'm ready for
Dallas.
summer, man. I'm ready. Bring on summer. Forget this
Yeah.
like winter stuff.
I'm ready.
All right, I guess we should roll into our first segment. And so this one I thought was interesting because something that I get asked about in my office, you know, so being a doctor and, you know, people ask me about medical stuff, you know, sometimes not related to plastic surgery. And so I get asked about alternative therapies. And so this is something that I've gotten asked about a couple of times. And so today I want to talk about acupuncture. So.
Okay.
And so this is what my title is acupuncture is acupuncture on point, or what's the point? Meaning, is it good or is it bad? And so I thought that we would kind of go through it and you know, see what it's used for, and then and look at some of the research papers about it, because those do actually exist. So have you had acupuncture or Travis, or have you or anyone you known had acupuncture?
Yes. I have not, but I know people who
You know
have.
people have had it. Travis, do you know people have had it?
I don't know anyone who's had acupuncture.
I personally don't either, outside of maybe like a patient or something that mentioned they had it, like personally, like a friend of mine. But I'll tell you, you know, it's possible that somebody's had it and they just, you know, have never come out in conversation. But it is, it's a very ancient medical treatment. And so
Yeah.
I want to do like a little kind of like side thing here. So this is one of the ancient medical treatments that still is used today. And so I wanted to pull up some of the things very similar and compare how old they are. So Travis, I got a slide, so throw it up here. So these are 6 things I found that are ancient therapies that we still use today. And the first one is cataract surgery. So Sushruta, who's this famous physician in India from thousands of years ago, actually was doing and describing cataract surgeries. And this was done 2,600 years ago. So that'd be what, 600 BC. Crazy. Next was acupuncture. So this is kind of going from like most recent to most ancient. Next was acupuncture. So that was actually first described in China about 3,000 years ago. So that's pretty old. Suturing of wounds goes all the way back to Egypt and about 3,100 years ago. So that's pretty ancient therapy we still use. Aspirin use. Now, of course, they didn't call it aspirin. It was willow bark, I think, is what the derivative of aspirin was. That was actually first used, again, in Egypt, 3,500 years ago. Tracheostomy. So do you guys know what tracheostomy is? Have you
Has
heard?
to do with your throat, I guess.
Yeah, that's right. Travis?
Is it something like with your throat?
Yes.
I just said
Oh,
that.
my bad.
So tracheostomy is when someone has some
Cheater.
sort of airway obstruction, like in the mouth or like the back of the throat. So a tracheostomy goes through the trachea at the skin, kind of right about the level of your collarbone. So that was actually described in Egypt so it's 5,600 years ago. So that's what? Gosh, 4,600 BC? It's crazy. And the last one, morphine use. So this was the most ancient medical treatment that we still use today. So that was actually described in ancient Mesopotamia. So it was use of the poppy, which is what morphine is derived from. And that was 8,000 years ago, so 6,000 BC. So I thought that's pretty cool. Like, it's one of the most ancient therapies that we still actually use today, along with these other things. So that's pretty kind of cool. So it was first documented in a medical textbook in China in 100 BC. So even though it was out like thousands of years prior, it actually is documented in a medical textbook. And the name of this textbook cracks me up. So it was the Yellow Emperor's Classic of Internal Medicine.
Oh,
It's kind of a random title, right? I mean,
sounds like witchcraft.
it sounds like witchcraft.
The yellow
I
ember.
thought it was a very creative title for something that's 2,200 years old. I don't know who the Yellow Emperor, well, I probably should have looked that up. The Yellow Emperor's Classic of Internal Medicine. It's a very lofty title.
Yeah.
I kind of want to read it, honestly. Anyway, so what is acupuncture? So acupuncture, as you probably know, uses needles. Now, these needles are very, very fine. So not like the needles that you would get like an IV from. I bet they're very similar to the like a tattoo needle. Like they're very, very fine. And so those needles are inserted into the skin to treat various health problems. And then the needles are either manipulated manually, so the acupuncturist moves them around a bit to do the treatment, or sometimes they'll actually apply electricity to them.
Oh.
Yeah, so that's called electroacupuncture, which I didn't even know that existed. So how does it work, right? So, being the doctor, I'm like, okay, well, how exactly does this work? Well, that's not 100% understood how it works. There's evidence that it does have effect on your nervous system, so your nerves, as well as other body tissues, and also that it has non-systemic effects. So a non-systemic effect is basically placebo. You tell somebody, I'm going to do this treatment, and you do it and they feel better.
Yeah.
And so there is at least some amount of placebo with acupuncture. What I thought was interesting though, so this was used in ancient China, right? And so the traditional Chinese medicine described these meridian lines in our body. So they thought that there were these channels of energy through which chi, you've heard chi, right?
Yeah.
I say that sometimes, and I didn't really know what I was saying. I guess I kind of knew, but I'll say something like, oh man, that really messed up my chi. That messed up my my mojo or whatever. So they describe chi as your life force, and the life force would flow through these meridian lines. And what they believed happened was that these meridian lines would get blocked, and so your chi or your life force couldn't flow through. And by using the acupuncture needles in these meridian lines, they felt that would stimulate the meridian lines and allow the chi or the life force to flow through.
Okay.
Now, of course, there's really no basis of this in modern medicine. I mean, we haven't discovered chi or meridian lines or any of that. So, I don't want to say that it's completely nonsense, but I'm just saying it doesn't necessarily jive with modern medicine. But all of that being said, I mean, you can't deny that there is some effectiveness to acupuncture, and so that's kind of
yeah. Also, it wouldn't still be around.
Right. Well, and that's exactly right. So, as it's very ancient. It really has gained a lot of popularity in the last 50 years. Like in the 1970s, it kind of made a resurgence. I guess with the people being able to travel more freely and people going to the Far East and coming back and to Europe and America, it started to pick up popularity. So today in the United States, annually, there's about 10 to 15 million people that get acupuncture. That's a pretty high number. I thought it maybe wouldn't be quite that many. What's more interesting is it gains about 50% more people about every 10 years. So it's 2023 now, I guess. So, if we have 10 to 15 million now, so in another 10 years, it'll be somewhere around 20, 25 million.
Oh.
So it's gaining in popularity. And as of now, roughly 10% of the population in America has tried acupuncture. So 1 in 10. That's why I was curious, asking you guys, do you know anyone who's had it?
Yeah.
I don't that I know of, but so the next thing is well, okay, what can you treat with this? So there actually was a list that was put out by Johns Hopkins. Travis, can you toss that up there? And I mean, you can blow that up on your computer if you want. It's got a laundry list of things, and some of these are kind of far out there as far as I'm concerned, but these are things that historically acupuncture has been used. I wanted to kind of narrow that down though, because that's just too much to even kind of wrap our heads around. So what I wanted to focus on was the NIH, the National Institutes of Health, have actually done research on what things acupuncture has been shown by research to be effective for. And so these are the things that popped up. So you got nausea, whether that be from surgery or chemotherapy, dental pain, addiction to drugs or alcohol, headaches and migraines, that one always pops up with acupuncture. Menstrual cramps, I was kind of surprised to see that one there. Tennis elbow, that makes sense. That's a nerve compression, issue or a inflammation of a nerve. So that could essentially, that makes sense. Fibromyalgia, which is a kind of a self-reported pain issue, that makes sense. Myofascial pain. Osteoarthritis, you hear about that one. Neck and back pain. Carpal tunnel syndrome, again, nerves. And then asthma, which I thought was interesting. And so I actually looked through all these studies, and I thought about pulling them up, but really I'd just be pulling up blocks of text. So I'm just going to kind of summarize them for you guys. The NIH did what are considered review studies. So they look at every study related to acupuncture and say headache. And so for each of those ones that was on that list, there was between 10 and 20 individual research papers that showed that acupuncture either had an effectiveness in treating that either alone or in conjunction with other modalities. Meaning, if somebody had headaches, they were trying one thing, That was one group, and then they would try that same thing plus acupuncture, and the group that tried both did better. So that would be in conjunction, more effective.
Oh, okay.
And so I thought that was pretty powerful. With each one of those, you were looking at 10 to 20 studies that show that there is definitely some effectiveness to acupuncture in treating them. And, it's like, for me as a physician, I'm like, okay, how exactly does that work? And, I don't have a great answer outside of, I definitely think that there is like, some placebo effect to it. I mean, that's well documented that there is. Also, too, I kind of feel like acupuncture might almost be akin to something like meditation. There's definitely some research out there that shows that people who, meditate or focus on something will see an improvement in whatever it is that they're, focusing about. So I think that there's some of that. As far as like the medical and affecting, chi or life force, I mean, that's a stretch for me. I mean, it's hard for me to embrace that.
Yeah.
But
I think that it sounds like it's something that you should try if you have some of those issues that are
right. And maybe like modern medicine is offering you some amount of, effectiveness, but maybe not quite as much as you want. And you want to just, go the maximum and try something else.
Yeah.
So, I mean,
it doesn't hurt to try.
Right. And so, okay, let's talk about that. So risks of acupuncture, it's very, very, very minimal. Like these needles are tiny, I mean, I guess there's maybe in the history of acupuncture, there's been the risk of somebody puncturing something that was, dangerous, like your intestine or something, but that's not a common thing at all. Like, I mean, that's a very rare extreme thing. The biggest risk would be related to infection, because you're piercing your skin. And so I think that was more of an issue, 50 years ago when this was making a resurgence, or certainly in ancient times. Nowadays, the needles are disposable, so it's not like they're washing the needles in the sink in between patients, right? They got like a fresh pack. It's like when you get a tattoo, right? They use a fresh needle every time. So so as far as the risks go, you're right. I mean, it's very minimal to no risk. Yeah. But I would say that if you're going to get acupuncture, don't go get it under the bridge, downtown, right? Go to
that wouldn't be.
There is licensed acupuncturists, So if you're going to,
a lot of chiropractors do acupuncture. I've heard.
Do they? I wasn't aware of that.
Yeah, because a lot of people go into chiropractic offices for
back
pain. So a lot of them practice that.
That's very interesting. I'm gonna have to look into that. I didn't know that there was.
Because one of my
See, that's why you're here, to bring up these things that I don't think about.
One of my friends, the person that I know that does it, he has a bad back, so he said that he's done acupuncture.
Okay, so did your friend say that?
He said he didn't notice a difference, but he has really bad back issues.
So it's pretty severe stuff.
Yeah, he has scoliosis, some herniated discs, and
Yeah, that would be a tough ask of acupuncture.
Yeah,
to fix
I don't know if little baby needles are gonna help you, bro.
They need to bring out the big needles.
Yeah.
So I don't know. I always, for something like this, always consider would I do this myself? I mean, I don't know. Maybe. I mean, right now I don't feel like I have any major issues outside of my just general neuroticism that I need to be treated.
I'd be interested to see where they put the needles because I know there's certain parts of your body where they put them to focus
Right, it's like the meridian lines.
The pain.
So
if you have a headache or chronic migraines, where they would put the needle.
So I would guess, that's a great question. I would guess that, for headaches, headaches are come about from your muscles on your scalp, that's why Botox helps,
Yeah, because I have a history of migraines and I used to have seizures. So.
Oh wow!
Yeah,
I think you mentioned that before, yeah.
Yeah. So they told me that if they kept giving me problems, that I could get Botox. And I was like,
Yeah. So I will tell you, I don't advertise in my office that we do Botox for headaches, but almost all of my patients who have a history of headaches who get Botox will say the Botox either eliminates their headaches or dramatically decreases the frequency. And in fact, my wife, for example, will say, I know my Botox is wearing off because I'm starting to get headaches again. Which is kind of funny.
Well, I have a habit of going like this whenever I'm concentrating.
Like frowning? You have a habit of frowning? I'm just kidding.
I do. It's called RBF.
Yeah, I know. All right, so acupuncture. I think that if you're interested in it, talk to your doctor. The only thing I'd say about talking to your doctor, I'm sure there's some doctors out there who would probably just say, oh, that's total nonsense. It's not going to help you. I mean, the research suggests otherwise, but I would definitely say that I would be hesitant to tell you to go into acupuncture thinking it's going to solve all your ills. If you go in thinking this might help me, I think there's a chance that you could find some benefit from it, but it's definitely not a cure-all. So
Yeah.
So anyway, all right, acupuncture. Yeah, let me know if you've had acupuncture or if you have questions about it. Please leave us a comment. We'd love to answer your questions. So, all right, I got another kind of crazy story to talk about. So, all right. We kind of take for granted, right, that when we go to a professional, that person's properly trained, right? I mean, you just kind of assume that.
Yeah.
And we've talked about fake plastic surgeons before. Now there's a new news story out this past week. Have you guys heard about the almost 8,000 fake nurses that were released out into the wild? Have you guys heard about this?
Well, you talked about it last show, I feel like.
Oh, I did?
I feel
think
like
I
you were
had brought
talking
it
about
up.
license.
You brought it up, Travis?
Yeah, I brought it up last time.
Oh, dang,
It
I'm
was a
sorry. I
nurse.
should have given you credit for the story.
Nah, you
I was like,
were-
I
You
remember
had mentioned it, and
hearing
then my
about
wife,
it.
my wife mentioned it, and I'm gonna sell why. But so there's almost 8,000 fake nurses out
Like,
there.
that chick's face looks super weird.
I'm going to talk about that too. There's almost 8,000 fake
What?
nursing diplomas that were sold in this like kind of fraudulent scheme. Now I'm going to ask you guys, where do you think this happened? Come on.
Florida.
Yeah, Florida.
Yes. What is up with Florida? Like
I told you the only people who go there to live that are not from there. Sketchy people. I swear. Like, if you're not from Florida, but you moved
you know
to
how-
Florida, there's some,
You know how last week
questionable
we were
things.
talking about how long is it going to be until we have a story about a bad plastic
Yeah,
surgeon?
one
Okay,
week.
we're going to start a new trend of how long is it
Medical.
going to be until
Just
we have another
medical
story about Florida doing something crazy?
Oh.
Yeah, so
It's daily.
It will never run out.
Right. It's
well, I mean,
literally
it has to be
daily.
related to the show, though. You're right. It would never run out. But I mean, as far as related to the show, it's like almost not every single time. It's like, but when we talk about bad stuff, it's often I don't know what's going. Is it something in the water down there? I mean, I don't know. It's a beautiful place. I love the
I mean,
vacation.
I told you one-
it is called the armpit of America, isn't it? Or something?
Florida?
Or
I don't
something
think
like
so.
that.
I don't think so. Maybe.
One time it was a rapper from down there. He said the reason why people in Florida are so off the wall is because they breathe the same air as the alligators. That was his theory behind it.
We're gonna have to do some research.
Prehistoric
We're gonna
air.
have
The
to do some,
alligator air.
we're gonna do some research on that. All right. So, by the way, throw that picture up again, Travis.
Yeah, I was like, there's something wrong with her
Okay,
face.
so you know what I did? I
looks
I
like-
used AI to create that picture. So I was looking for a photo to make for the nurse, like something with a nurse and a diploma. So I have a couple of AIs I use. So I plugged in surprise nurse holding diploma, and that's what popped up. And I was like, yeah, I could see that. I mean, but you're right. She looks almost like she's
like an alien.
like she's
That looks scary.
Like she's possessed. I kind of put it in there to see if you guys would notice. I was like laughing when I was making that. Of course, I added the New York Times and the little emoji.
Hey,
but-
I'm gonna tell you like this: AI has to be stopped. It has to be stopped.
Dude, we
that is
could
terrifying.
we could do a whole like episode about that Chat GPT. Like it's going crazy, man. I think it's coming self-aware. Like Skynet's here.
I haven't used it yet.
You haven't? It is wild. I mean, what did she say?
What'd you say?
I love AIs.
She said she loves AI.
See, it's getting to our kids, man. They're like brainwashing them.
It's
She
getting
needs,
to our
she
kids, man.
needs to watch
Dude,
all the
we
movies
may-
about AI turning on you.
We may have to do a segment. I know it's kind of off topic for what we do, but we may have to do a segment about the Chat GPT because that thing is. We talked about it like briefly
Yeah,
a month or so ago.
You said you wanted it to write a paper or an essay or something.
Yeah. Oh, dude, it's crazy. I mean, the thing is like
Yeah.
unbelievable. Anyway, what were we talking about? Oh, the picture. Yeah. We've derailed the show. It's fine. We're good. All right, back on track. So, yeah, I made the AI picture. I thought it was funny. I want to see if you guys would notice that something was off.
That you made like a lizard woman. up there?
Yeah, right. I didn't ask it to be a lizard nurse. I just said make a nurse.
Oh.
That's what it gave me. I don't know.
AI said lizard.
AI is lizard people. Okay, so there's 3 schools in Florida that have since been closed. Siena College, Palm Beach School of Nursing, and the Sacred Heart International Institute that were nursing schools.
Palm Beach sounds sketchy right off the bat.
Word. So over 24 people have been charged by the U.S. Justice Department. And you know what they charged them with? Was wire fraud. Isn't that interesting? I mean, I guess they
Like wire, like banking wiring?
I guess wire meaning like over like communications, like
Oh.
internet or phone, I think, or mail. I guess not mail fraud, but wire fraud. Yeah. So these people are facing 20 years in prison. So it involved RN and LVN degrees, and they were sold reportedly for between $10,000 and $20,000. So they would go out and solicit people. I mean, I don't know what these people think. This reminds me of the guy last week that had the fake COVID shots or real COVID shots that he was giving out, not giving the shot and giving them that thing, you know, where they would ask people who wanted to do this. I mean, you know that that's wrong, right? I mean, these people at the nursing school had to understand that.
One, it's like how much was it? $10,000.
$10,000 to $20,000.
Like, but nurses really don't make that much to.
Oh,
like,
we're gonna talk about that.
I mean, I know nurses make a good amount of money, but
yeah, but right, but
for you to spend $20,000 on a.
But think about how much nursing school costs. It's like going to college.
I mean, it is.
It's much cheaper to get a fake one.
I mean, I guess, but do you have to pay it all at once because it's fake? Like,
well,
you
yeah,
just have to,
probably.
like,
I mean, it's shady. It's like
you have to have like $20,000.
It's like a drug deal, right?
Like,
I'm sure you know the drug dealers don't take credit, right? I'm sure like the shady like nursing degree sellers probably don't take credit either.
I think that's so weird.
Yeah, $10,000 to $20,000.
Like if you're really hurting to be a nurse.
Well, think about it though. So say you wanted to be a nurse, right? I mean, paying the devil's advocate. So you want to be a nurse, but you know, one, maybe you can't get into nursing school because I mean, you have to have certain grades to get into that, or you don't have the money, you know, to get into nursing school. And these people are saying, look, for $15,000, we'll get you a nursing degree and you can start being a nurse right away. Be like, I mean, it's definitely cheaper. I mean, I'm not saying you should do this, obviously, but I can see why they found people, you know, that were unscrupulous. So this went on between 2016 and 2021. So for 5 years this went on, and the nurses went on to work in Florida, Ohio, New York, New Jersey, Massachusetts, Georgia, Maryland,
and Texas.
And remember, I mentioned that you know, my wife was talking about this. Well, because when she heard about this, you know, I don't know if I'm sure I've mentioned this. My wife is the executive director for student health at the University of North Texas. I mean, she oversees, I don't know how many employees she has, like 100 maybe? I don't know. I mean, it's a huge, massive building. It's like not as big as a hospital, but there's tons of people there. And so when this story broke, you know, she had to go and check and see if any of her nurses like had degrees from these places between 2016 and 2021. I don't think she found any, but
That's scary. I've definitely heard about like online schools giving out like fake like GEDs.
Fake GEDs.
High school diplomas and stuff
really?
like that. Mm-hmm.
Man, I mean, people will do anything to make a buck. I just don't know how people don't think they're not going to get caught. Like, if you're out there saying, hey, I will give you this fake diploma for money, I mean, you have to know that that's a crime, right? And eventually someone's going to say something. I mean, it's not something you can keep secret. I just don't understand it. I mean, obviously it is a crime. And the biggest thing is not only is it risk to public safety, because now you have 8,000 nurses out there who don't necessarily know what they're doing, but it also like erodes the public trust, right? I mean, you know, with COVID and like the vaccine stuff, I mean, I think that, you know, the general public in America is like a little wary of, you know, healthcare to a degree, or at least some people are. And so this is just like another thing that just erodes the trust. And it's all because, you know, people wanted to make a quick dollar, you know, and do something shady. Like, it's bad news. But
it is.
Also, it's kind of interesting. Like, I just wonder, you know, I mean, do you think they figured this out because nurses would show up at a hospital? I mean, and none of them had done it in nursing school. I mean, so they would show up at
maybe they did go to nursing school and they just didn't
graduate.
Diploma. Like
No, I can't imagine there'd be that many that like that went to nursing school.
Or maybe they couldn't pass the license for.
No, because that's actually separate. So you have to have your diploma first, and then you. So I guess these people did have to pass the licensing.
They would have to, unless they're getting fake licensing too.
I don't know. That's a good question.
That's what I'm saying. Like, maybe they went to college, they just couldn't get past the courses.
I'm not sure. Yeah, that's interesting.
I have no idea.
So I did want to talk about, you know, how to become a nurse legitimately, because I do think that nursing is a great career. I mean,
my mom is, and then my sister's a nurse practitioner.
Yeah, you mentioned that. I'd forgotten that, but that's
And
that's
I
great.
wanted to be a nurse.
Did you? Yeah.
But I got a degree in health instead.
Okay, very good. Well, I work with a ton of nurses. I think a lot of nurses. I have a lot of nurses that are good friends of mine. So I just want to talk about, if you know, obviously don't do this shady thing where you get a fake degree, but how would you go about becoming, you know, a nurse like legitimately? And so there's a couple like levels of nursing. So I'm going to start with RN, so registered nurse. And there's actually two levels of that. There's a associate's degree in nursing and then a bachelor's. So for associate's degree in nursing, it's 2 years after high school that you do to get your associate's degree. Now I will say that recently, kind of the standard of care in the industry has gone to where you have to have a bachelor's. And so if you have an associate's degree in nursing, a lot of hospitals won't hire you. So although there is a 2-year degree for RN, most people say that it's not really worth anything anymore. So you have to do the 4-year plan. So the 4-year bachelor's degree is, you graduate from high school, you apply to the program, you do, 2 to 3 years of classwork, and then 1 to 2 years of clinical. So a total of 4, however they divide it up, either 2 and 2 or 3 and 1. And then you have to pass the nursing exam, so that's the next part. And then you have to obtain a state license. And so if you get your RN, so the average pay for an RN, and this is just average, it varies a lot by where you live, like what specific job you're doing. It's $60,000 to $75,000 a year. So pretty good money. I mean, definitely nothing wrong with that. And there is the option to go further because I think you said your sister's a nurse practitioner, so that's another level up. Of course, it requires more training.
Yeah, my mom, she was an RN, but she became the manager, like the head nurse.
Oh, okay, like charge nurse or like nursing supervisor?
But, for Tarrant County Public Health. So my mom was in charge of like
right.
3 or 4 clinics and stuff.
I think that's one of the coolest things about nursing, and it has even more flexibility than I think, having an MD, in that there are just so many different directions you can go with it. Like, I mean, obviously there's nurses on the floor at a hospital, then there's nurses in the OR, there's nurses in the ER, there's, nurses that I work with that do wound care. Then there's like all of the administrative side that you can get into, which really doesn't translate as well with doctors. I mean, you can, like as a doctor, be like a chief medical officer of a facility, like that's something you could do. But I think there's a lot more options with nursing, that you can do on the more administrative side. So, and then outside of RN, then there's LVN. So LVN is like a step down from an RN. So this is where you complete a 12-month or 1-year program after high school. It has some classwork and clinicals, and then you go on. You have to pass a separate exam. Average pay for them is around $50,000. So a little bit less for doing that, but definitely. I mean, a nice, good salary doing something to help people that gives you a lot of flexibility. And I know a lot of nurses that get their LVN and they go on and get an RN. There's a great nurse in my wound clinic named Alice, who's about to get her RN. Congratulations, Alice, if you're watching. I know you're going to pass your test. So, but yeah, nursing, it's a great field. But don't get a fake nursing degree.
Yeah,
I hate fake plastic surgeons, and I don't hate fake nurses. I can hate fake plastic surgeons. I don't hate fake nurses, but I don't like that. Don't be fake. It's bad.
No.
I mean, it's just bad, all bad. All right.
Dangerous business.
It is dangerous, right? Yeah. I mean, there's definitely some danger to it. So
people be crazy. From Florida, mostly.
Florida. All right, we're starting the clock. So we've gone 1 week without a plastic surgeon doing something bad. We've got 0 weeks on the Florida counter. We should have like a whiteboard. I'm gonna bring a whiteboard in and we can like put a mark. It's been 1 week since we've had a bad story about Florida.
That's so shady.
Crazy stuff. All right, we're gonna talk about some celebrity plastic surgery. All right, do you guys remember?
Again,
what?
Crazy celebrities, plastic surgery.
Do you guys remember Heidi Montag?
Yeah, I do.
Mm-hmm.
I watch her husband all the time on.
Really?
He's like super famous on TikTok for feeding hummingbirds.
You are kidding me.
I'm not.
Heidi is it Montag or
I don't know.
Montag, right? Travis, help us out.
Who's to say?
I believe I wasn't the biggest fan of that show coming up, but I think it was
yeah.
Heidi Montag.
Yeah, that's what I think. I just want to make sure I don't pronounce it wrong. All right, so all I remember about her, obviously I've done some research in the past, few days, but all I remember about her is she was on some reality show, and there was all this like talk about her in the media because she had a bunch of plastic surgery. That's all I remember. Mm-hmm. I mean, I couldn't remember
she looked like she got some stuff done to her face.
Oh man, it's crazy. All right, so why she kind of popped back up in the news is she recently revealed a bunch of details about her extensive plastic surgery on the podcast called Broad Ideas with Rachel Bilson. Not familiar with it. You guys heard of that podcast? I mean, it has to be pretty big, I guess, to get Heidi Montag to come on it. Mm-hmm. Yeah, so I didn't know about that, but she was on this podcast and she was talking about all these plastic surgery rumors that popped up, and it was honestly, I was sad when I read it. Like I just felt bad for her, and it makes me kind of angry. And I guess this is almost like like a plastic surgeon doing something bad, but this is like a long time ago, so we're not going to count this. So we're not going to like ruin our streak of plastic surgeons doing crazy stuff. But so talking about her plastic surgery, so of course she was on the reality show The Hills. Vaguely remember that, it was on MTV, and then she went on to do a bunch of other stuff. This is like in the mid 2000s. So when she was 20 years old, 2006, she had a rhinoplasty and breast augmentation. So for somebody that's like on TV, I mean, very common stuff, touch up your nose, do breast augmentation, not uncommon for celebrities, right?
Yeah.
So, I mean, if that's where she would have stopped, then, I don't think she probably would have ever been on the radar as far as, issues with plastic surgery. But then in 2009, when she was 23, she had 10 surgeries in one day. 10 surgeries in one day. It's one surgery, but 10 procedures. And she listed out some of them. So she had a brow lift, an ear pinning, chin reduction, a revision of her rhinoplasty, and a revision of her breast augmentation, along with 5 other procedures. And when I heard that, I didn't realize that was the thing. I mean, that's insane. It was a 16-hour procedure.
Why? Why would a doctor?
You're not going to believe this. Like, it just gets worse. So there was this surgeon. His name was Dr. Frank Ryan, who was a board-certified plastic surgeon, celebrity plastic surgeon in Beverly Hills. And so he actually solicited her to do these procedures. Like, she did not come to him looking for plastic surgery.
So was it for free?
Yes. So I think he actually sent his people to her and said, hey, Dr. Ryan is willing to do plastic surgery on you for free. Would you be willing to come in and have a consult? And so, she's 23 years old. There's all the pressure of Hollywood and being a celebrity, and so she did that. And it gets even worse. When she got in there to do her consult, he started saying all these things that were wrong with her. Like, he started pointing out all these things that he called imperfections that he wanted to fix. And she was talking about how, like, it really, not kind of upset her, but like it kind of, got into her head.
Yeah.
And she said, oh my gosh, I didn't know that there was so much wrong with me, which is just crazy. I mean, I don't know, this is where I started to, get kind of like angry, hearing about this, because first off, you have a plastic surgeon soliciting people for surgery. Like, I would never like come to you, Sarah, and say, oh, hey, Sarah, I really want to, I think you really need a nose job, come see me. I mean, I don't even do nose jobs. I'm just like picking something out of there, right? But like, I mean, I just think that that's like wrong. I mean, if somebody asked me about something, I'm happy to give an opinion, but never in a million years would I go to someone and say, hey, I think this is wrong with you, and I want you to come pay me, or even to do it for free, which is what he did.
That's just straight up rude.
I mean, it's almost, I feel like it's predatory, honestly.
Well, she's so young, too.
Yeah, she's so young, she's just, a budding celebrity. And he comes up and not only says, I want to do surgery on you, but then he starts like suggesting all these different things. I mean, that's another thing that I'd never do, like when I do consults in my office. Like, if somebody comes in and I have people ask me this, they'll be like, well, what do you think I need to have done? And I'm like, sorry, I don't do that. I mean, you tell me what you potentially want to change, and I'll give you my opinion, but I'm not going to tell you what surgeries you need to have done. That's just wrong. I feel like that's almost like abusing like your power as a doctor, right? Because a lot of people will think, oh, this is a plastic surgeon, and he says I have this wrong with me. Even if they don't think that that's wrong with them,
when they look in the mirror,
then they're all going to be thinking about it, right? Yeah. So this guy, this Dr. Ryan, who I don't like at all.
You keep saying does he not practice anymore?
Yeah. So so this guy was almost like a predator, like, I mean, it just made me feel gross, like reading about her talking about her experience. And so anyway, so she had to done a 16-hour surgery, which I think is completely malpractice. Like, to do a 16-hour surgery on somebody. I mean, I do mommy makeovers. I limit them to like 7. Like, that's it. If somebody wants more surgery, then I'm like, look, I'm not going to do it. You have to break it up into 2 different days. Like, there's just a certain amount of time that's safe to be under anesthesia. So, he did the 16-hour surgery after he, was a predator to her. Like, the whole thing is just horrible, like criminal. Honestly, I think it's almost criminal. Like, I mean, if I was like in charge of a medical board, like I would pull that guy's license for doing something like that. Anyway, so I don't have to do that, because in 2010, so the year after he did all this, he drove his Jeep off a cliff and he died. So
Purposely?
No, I don't think so. They said it was an accident. I don't think he did on purpose. Like, it sounded like he had everything going pretty good. Yeah, he accidentally drove off a cliff and he died. So, and you know, it's funny because Heidi Montag came out when that happened, and I almost feel like, and there's more to the story too, by the way, like her experience was very bad, but at the time no one really knew that, and so when he died, I don't know if she did on whatever the social media at the time was. What was in 2010? Facebook? MySpace?
Twitter.
Twitter? Was Twitter? Oh yeah, Twitter was around. She said, "I am devastated."
Our field correspondent says Tumblr was big in 2010. That's what she said. She said Tumblr.
I don't think Tumblr was out in 2010, was it?
I wasn't alive then. So
Oh gosh.
You weren't alive. That's sad.
You were alive in 2010, just at the end of it. All right. Yeah, so she wrote about Dr. Ryan, "I am devastated. He was the most amazing person I've ever known." Oh man, that almost seems like Stockholm syndrome to me. I mean, because she actually had a bad experience, and this is what she was talking about on this podcast. So she said the surgery nearly cost her life. She was in so much pain when she woke up. They had to give her so much Demerol that reportedly her heart stopped. Like that.
Ew.
That she said that she almost died from having all these plastic surgeries, which, you know, like I said, it's dangerous to do that much plastic surgery at once. Like your cardiovascular system can like go into like, you know, a tailspin from being under anesthesia.
Not only that, I feel like that a doctor putting himself or herself through that like long of a surgery could like make them tired.
Yeah,
Like
I mean,
that
there is that
long?
aspect. I mean, I didn't even think about that because I would guess he probably had a team of people where I do all my own stuff start to finish, but that's kind of a rarity. A lot of plastic surgeons.
Like I guess if he had like a certain physician for each procedure.
But I mean,
like,
you're on the right track that it's just not safe for reasons 1, 2, 3, 4, 5, you know,
For sure.
down on. Like it's just not safe. Like I said, I think it's like borderline
very
criminal.
questionable.
Yeah, borderline criminal. But she was so she reportedly almost lost her life. You know, because they said that she coded from having too much pain medication because she was in so much pain. And then she said her recovery was horrible, like so bad that she missed like work as an actress because, you know, her recovery lasted way longer than she thought it was going to. She didn't go into if she had any complications. I mean, that was, I don't think she did. Like nothing major outside of almost dying. I mean, you know, like regular complications. But the other thing that was really sad is that when she did that, it caused a big rift with her parents because she came out looking like a different person. And, you know, and her parents were like upset about that. They're like, "Why did you do this? Like you were more beautiful before. Now you're this fake Barbie doll." And then she got really, you know, upset about that, and she had a big rift, you know, with her folks. And so here's one of the befores and afters. So I'm just going to point out things you can see. So on
her
the
nose. It's like
yeah,
the
you can see how she's had a rhinoplasty. I saw another picture of her where I think the revision like didn't help her. Like to me, it made her nose look too thin, and I think they went a little bit too far. The chin reduction, I mean, it's pretty subtle. The breast augmentation and revision I thought was a little bit out of control. Yeah, I mean, to me, that's just too much. I
mean, she was beautiful before.
Yeah, she was.
She just looks.
I
she just looks more Hollywood.
I just
for
feel.
sure now.
I feel like that
Still.
she was taken advantage of, honestly, by this doctor. You know, for him
Well,
to.
she was new to the celebrity life, and
Yeah.
she had this doctor like,
Right.
"I'm choosing you out of all
Right,
of
and-
these people."
And she mentions,
blah,
you know,
blah,
like
blah.
she's like, say, "Why? I got like $100,000 in surgery for free. Like, who would turn that down?" You know, I mean, but I don't
And
know.
she was probably thinking like, "When's the next time I'm gonna be given this opportunity? I better just."
I
roll
felt
with
really
it."
sad for her, you know, hearing that story. I think that she was taken advantage of, and you know, per her own reports, almost cost her life. And you know, I just that doctor. I mean, you know, I hate to speak ill about the dead, but like I was really angry hearing all of that stuff that he did. Like that's just wrong. You know, anybody who does that kind of stuff should not be practicing medicine, in my opinion. So
Definitely another example of like how plastic, like when you do too much, it's never
Yeah.
a good thing. Too
Yeah.
much of anything is never
yeah,
a
I
good
think
thing.
that you know.
So.
Like, what can we learn from this? I mean, if you're thinking about plastic surgery, I mean, if you have a plastic surgeon that is soliciting, you know, "Oh, I want to do this surgery on you," you know, I think they should be wary. Also, if you go in for a consult for one thing and then a plastic surgeon is suggesting, you know, 5 different other things, I mean, I think that you should be concerned about that. Because the
That's
point,
like straight up emotional manipulation.
it is,
there.
right. I agree with that. And so, and I know it happens frequently. I think I'm probably in the rarity where I'm not like a suggestive seller of plastic surgery. Like if you come in and
Like if somebody comes in for breast augmentation, you're not like, I noticed something
you don't
else.
need. Now, if they
Yeah.
mention something, I'm happy to give my,
Yeah.
information. But like I said, if people say, what do I need? I'm just like, no, I'm sorry, I don't play that game.
You're like, yeah, what do you need? Tell me.
Yeah, you tell me what you
You
need.
could say like you need an elf ear.
An
Yeah.
elf ear. Yes.
Yeah, you need to solicit
I am
your
gonna start
skills
soliciting
for
elf ears.
I had to sneak it in.
I do. It's been a couple weeks. We haven't talked about the elf
I
ear.
had to sneak it
I
in.
think before this show ends, however it ends, whether in glory or in flames, I feel like I should do an elf ear surgery before it ends.
Let me know.
I mean, it's gonna happen.
I'm like 1, 2, 3, not it.
I'm about to say, Sarah,
1, 2, 3.
you may have to be like
Travis,
a
all right, buddy, let's go.
Me, I have small ears, so it probably
Yeah,
wouldn't-
we'll have to find someone else.
Yeah, it wouldn't look
I
right.
bet if I got online, I bet you anything if I got on, TikTok or something and said, hey, I'll do a free elf ear surgery if anybody wants. I bet I'd have 10 people call.
Absolutely.
100%.
Absolutely.
I don't know, it makes me nervous though. I may have to go
And
do.
you're like,
You know what I
just
may do?
joking.
I mean, if I was gonna seriously do that, I'd probably go to a cadaver lab first. I think I mentioned that before.
Yeah.
If I was gonna do that for real, I would go to a cadaver lab and do it on a cadaver first and
Yeah.
make sure. I know I could do it. I feel like I have the skill.
Especially with these-
Elf ear. Okay, so just to
Crazy.
clarify, we got 1 week since we've had a bad. We're not going to count this guy because he's not around anymore and it happened a long time ago. So we've had 1 week without a bad plastic surgeon story, and we've had 0 weeks since a crazy Florida story.
Yes.
We're gonna have to keep a running tab, and we've had 0 weeks since an elf ear mentioned. So I don't know what all this means, but I feel like we should definitely keep tabs on it.
We don't know what any of this means.
I don't know what any of this means, but I think we should definitely keep tabs on. All right, I think that's about all we got time for. Thank you guys so much for watching. We'll see you next week on Nip Talk.